I understand that you are extending clinical pharmacy services into general practice and community pharmacy. Could you tell us a little more about this?
During 2024, earlier this year, we we in the Department of Health actually published two separate strategies for relating to pharmacy practice. And the first one was a strategy for general practice pharmacy, and the second one related to community pharmacy. And in the general practice pharmacy strategy, the key goal really is to develop the clinical pharmacy workforce in that setting. So we already have pharmacists working in all of our general practices, but really the value that they're bringing to that multidisciplinary workforce has been recognised to such an extent, and through our evaluation that I mentioned earlier as well, that now we're in a position that we want to seek further investment to introduce a full pharmacy team within general practice. And that would have a mix of skills. So that would have ideally a pharmacy technician, the pharmacist, and also an advanced practice pharmacist roles as well. And in that, through that strategy, really, we did set out very, very clearly that we believe there would be great value in a pharmacist becoming the clinical lead for medicines within general practice and within each practice. So that's a significant statement that we've made, and for that actually we have the support of general practice, because we co-produce the strategy with general practice and pharmacy and other stakeholders. So that's sort of one of our major I suppose achievements this year was the publication of that very positive strategy. Now the second one is in community pharmacy, and clinical pharmacy and community pharmacy, I suppose, is less well understood what we mean by that. And really in Northern Ireland, I am seeing that we will take a sort of phased approach to this. And at the moment, we have already got an established pharmacy first service, which is allowing pharmacists to address the needs of the public without the need to go to a general practitioner, and for a range of conditions. And I'm very keen to increase the scope of that service and to increase its clinical impact. And in that community pharmacy strategy, I suppose our first goal is to increase the range of clinical services that will be available through community pharmacy. And an important part of the evaluation that we do in this sector as well is to demonstrate that we are able to shift work from other sectors towards community pharmacy, and that is creating capacity within our wider health and social care service. And I'm very keen to do that in clinical services in the future, and also knowing that in this sector we are going to very soon have a large number of independent prescribers in that sector in the future. So over those two strategies in Northern Ireland, I suppose what we are doing really is we are really translating clinical pharmacy from our traditional hospital clinical pharmacy and what we understand in that setting across the system into general practice and community pharmacy.
And what next for pharmacy in Northern Ireland? Where do you go from here?
So in Northern Ireland, of course, we have further ambition, and certainly from my perspective, there's a number of areas. I've just chosen three that we are either already moving into or we plan to very soon. And the first one is we will be placing a big emphasis in the coming years on how we make the most of this independent prescribing skills within our workforce. And we'll be looking at that across all sectors. And we aren't assuming that they are being fully utilised, as well as they can be in any sector at the moment, and not even in hospital or in general practice, let alone community pharmacy. So that's going to be a big area of focus, and I know there's a lot of interest in that across the UK, and we'll all be learning together, and then trying to introduce some new services and commissioning models to really support and embed independent prescribing into the roles of pharmacists in the different sectors. The second area is really building on the work that we have done on our efficiency program and keeping our impact, I suppose, very high in terms of, keeping attention on the impact that we can make. We are just about to go out to publish for consultation a new valuing medicine strategy in Northern Ireland. And this is really to build on the work we've done previously, to continue a focus on cost effectiveness, but to also place a new focus on the need for us to have much more environmental awareness around our medicines, to vastly improve how we use data in relation to medicines, and also look for the first time in a while at some of our supply models and their cost effectiveness and efficiency. So look out for that in the next couple of weeks. And the third area that we'll say that is our plan to do next year, and that is to revisit hospital pharmacy practice and clinical pharmacy practice in that setting. We haven't done that for a few years, and in Northern Ireland, all of our hospitals by the middle of 2025 will have implemented the EPIC system. And I think that gives us a tremendous opportunity to really think about clinical pharmacy in a truly digital age here in Northern Ireland. So that's something we will be undertaking in 2025.
And finally, do you have a closing message for those who are perhaps less far along the road than you are?
I suppose my message is Northern Ireland is a small country and there's a small number of us involved in really trying to affect change. So I think that what we do here is very, very translatable to lots and lots of other countries of different sizes. And we have had to work incrementally and we've had to build over time. And so things don't happen overnight. But I have a couple of thoughts about what advice I could give to people who are interested. And I suppose the first one is really engage with stakeholders and to do that early on and continuously and to really go out to get buy-in for what you want to achieve from all parties and be clear what you want to achieve, but also in working with stakeholders, work with the willing first, because that will keep and preserve your energy. And that has paid off a lot for us. And you'll find there are a lot of people who are willing to work with us. The second area is to focus on small wins and measure your impact ruthlessly. And remember that your impact has got to be of value and importance to the stakeholders who will ultimately make decisions about investing in your roles or your new services. Thirdly, prioritize, have a plan, and focus on leadership and your leadership and the leadership within your system. And finally, I would say always, always stay patient-centered. That is what we are about, and that provides the strong foundation for everything that we aim to do in pharmacy.
Professor Cathy Harrison, thank you very much for talking to us about this important topic. That really has been terrifically interesting and inspiring. For more information about the work described in this interview, please visit the website using the links in the description and be sure to subscribe for more news, videos, journals and podcasts. For updates straight to your inbox, please follow the links below. And thanks for watching.